Aloha and welcome, everyone. I'm Mike Kakane, CEO of the Hawaii Community Foundation. Mahalo for joining us today, and thank you for your generous support of our community through the Hawaii Community Foundation. We're offering these virtual briefings as a way to share insight and provide access to key leaders that are really stepping in on the COVID crisis. And I'm really excited about today's conversation. But before we get started, I'd like to acknowledge and thank members of our Board of Governors who are with us today. First, our Chairman, Peter Ho. Also joining us this morning, Jeff Arce, Alan Arizumi, Debbie Berger, Mary Bitterman out of San Francisco, I might say, Judge Mike Broderick, Kalei Kadena, John Dean, Bob Harrison, Mike Irish, Dr. Tyree Jenkins, Elliot Mills, Kathy Richardson, Jennifer Sabas, and Leah Sheehan. Thank you very much for your support and your leadership of our organization. The role that HCF has been playing could not have been possible without all of the support of the people that are on this call. The Hawaii Resilience Fund will approach $12 million very shortly. By early next week, we'll have pushed a little more than $10 million to nonprofit partners throughout the state of Hawaii. As many of you know, we're using a four-phased approach to our work, and this is guiding our grant-making strategy. The key to this work is finding really good partners that can help you leverage and have greater impact, really impact at scale. We saw this early on with our partnership with Bank of Hawaii and the City and County of Honolulu and the Food Bank. Peter's active role and funding was instrumental in helping us to get the city to step up to match our $1 million contribution to launch really at scale a really massive food distribution effort. As a result, we're partnering with other counties around the state, and we're excited about that work. Last week, we announced another very exciting partnership with the First Hawaiian Bank to establish the Stronger Together Hawaii Scholarship Fund. Together, we are seed funding this new initiative with $2 million. This program dovetails a recently launched program by the University of Hawaii called the Next Step program that specifically targets the 11,000 graduating public school seniors. The university estimates that left unaddressed, the post-secondary enrollment for the class of 2020 into the UH system could drop as much as 60%. These kids, their last semester was really hijacked by COVID. And unfortunately, in the public school system, this is the most critical time where students are finding their way to a possible post-secondary opportunity. And so the collaboration that was needed to launch our partnership with the university would not have happened without Bob Harrison's personal engagement and their funding. Going forward, as we start to move into the next phase of our work, you're going to see more of this type of efforts on our part to really try to have impact at scale, engaging government as partners, engaging large foundations and corporations, and really trying to push the dial forward so that we can move this economy. And the biggest philanthropic gift we can give the people of Hawaii is to get our economy going. Now to our program. I was thinking hard last night on how best to introduce Ray. And, to put it simply, this guy is a wedge breaker. He thrives in challenging times, doesn't shy away from, difficult conversations. In fact, in early or mid-March sometime before COVID was getting any traction, it was Ray that reached out to Peter and I to join him on a Sunday to meet with the governor to request that the governor take swifter action to try to flatten the curve. And that wasn't an easy conversation by any stretch. He's been a huge resource to me and my leadership team so that we could better target our grant making and understand where we are in that COVID cycle. His leadership team has worked with us on coordinating more than $1 million in PPE purchases, and it was just always there for us as a partner. Before I bring Ray up, just to remind everyone that if you have questions during this briefing, please use the chat box and we'll be sure to try to get as many of those questions answered at the end of the presentation. Now it is my pleasure to introduce a dear friend of the Hawaii Community Foundation and definitely a leader in our community, Ray Vara. Ray, the floor is yours, buddy.
Thanks, Mike. I appreciate the nice introduction. Thanks, everyone, for having me today. And I guess more importantly, thank you for all of your leadership and the work that you've done to support our community during what is really, truly unprecedented times. And without your leadership, we'd be in a much different place as it relates to what I consider the humanitarian issues that are facing our community. And so next slide, please. So this one I'm going to cover today. Talk just briefly a little bit about who Hawaii Pacific Health is, what we've done to respond to the pandemic, and what it does to shape our view of healthcare in the future. Share a little bit about the current data and what's going on with the prevalence of the virus, and then and talk about the 4 phases of the pandemic from my perspective. Next slide, please. So this is a little bit about Hawaii Pacific Health. We've got our 4 medical centers. Hopefully most of you are familiar with a little bit about who we are, but we've got Kapulani Medical Center for Women and Children, Straub Medical Center, Polimomi Medical Center, and Wilcox Medical Center on Kauai. We also have about 70 different locations around the islands under different brands. We've got just over 7,300 employees, 1,500 or so physicians on staff, with about 600 being employed physicians. And as you can see, we do a fair amount of volume of activity across different services throughout the community. Next slide, please. It's our mission and our vision. I want to talk a little bit about this because this really shapes the way we view our role within the broader community. First is to be the leader in healthcare transformation. In our mind, healthcare in this country has been broken for a long time. Right now, it represents 18% of the GDP across the country, and if you look at the way that projects out relative to all of the things that make up the GDP, by the year 2050, that's estimated to be at 38%. We will have long since bankrupted the country, and so we believe there's been a need for change, and we've been on a journey to begin that transformation and invest in that transformation, and we think that's through providing a higher quality of care at a much more reasonable price, and that in itself will create a value equation and a value-based healthcare system. And that's going to require a lot of change. But fortunately, as a result of what have been difficult times during the pandemic, we've been able to advance many of those strategies. Next is our mission, which is to create a healthier Hawaii. To create a healthier Hawaii. And we view that in the broadest sense. And we recognize that it's much bigger than just what we can impact within the walls of our facilities. Next slide. And so that's where the social determinants of health come in. We're very clear that if we're going to truly create a healthier Hawaii, the health of population is only defined about 20% by the work that we can do within our organization, within our facilities, within our clinics, and things of the like. The rest is going to be impacted by impacting the social determinants of health, looking upstream and truly changing what's happening deep into our community. And so that's things like early childhood development, the education system, affordable housing, addressing homelessness, going after food insecurities, and things like that truly are upstream long before people present within the walls of our institutions. And so we think that's part of our mission. And we think, given the size and scale of Hawaii Pacific Health, we have a responsibility to truly work with other leaders, other organizations, and partner, and where appropriate, provide leadership to make an impact in each one of those areas. Next slide, please. So this is a little bit about the timeline just within the first couple of weeks of COVID-19 as it relates to Hawaii Pacific Health. And what was happening in the state. So as Micah mentioned, it was, I remember we were looking at what was on the landscape. We had just stood up in early March our command centers within our organization, which gave us a central command and control way of managing what we were expecting to be a significant surge impacting the islands. And shortly after that, on March 15th, as Micah said, Peter and Micah and I went and met with the governor and urged him to take several steps. We asked him to at that time, close the schools. And fortunately, later that afternoon, he extended spring break. We asked him at that time to limit group gatherings to 50 people, and shortly thereafter, it turned to 10 people. We'd asked him to be prepared to close restaurants, bars, and clubs, and be prepared to issue a quarantine for inbound travelers, because we understood that it was outside his jurisdiction to be able to close the airports. And as Micah said, those were difficult discussions. There were questions that we had never asked of our leadership before, and we recognize that while things didn't happen along that timeline as quickly as maybe we would have liked, we didn't sit in the chair that the governor sat in, and these are difficult decisions and had second, third, and well beyond that level of consequences based on those decisions, and we've certainly seen the results of that. We also, within the next couple days, within our organization, we're able to stand up drive-through testing sites. We were able to stand up what we call respiratory evaluation clinics, which were off-site locations for our patients to go who are symptomatic, so we could keep them out of the emergency room, out of the general population, and out of their physician offices, so that we would limit the spread of the virus at that time. And then within a week after that, we were able to stand up virtual clinics and essentially allow our physicians to continue to be able to see those patients that they needed to see for more routine care or care that was acute but not related to COVID-19 through using virtual technology. We were also able to send just over 1,000 employees to a work at home environment within that time frame as well. So a lot of activity happened within the organization and throughout the state during the course of just the first couple weeks of the spread of the virus in an active way here in Hawaii. Next slide, please. And this is really the last piece of what we did at Hawaii Pacific Health. Is we thought it was important as we worked our way through the first surge, was to understand what that impact was from a prevalence standpoint, both within our employee base, but we also felt that that would give us a feel what the impact was on a community-wide basis. What we were trying to find out was, is there a asymptomatic or mildly symptomatic population within the islands that had been infected with the virus, but it wasn't showing, or they hadn't been tested. And you can see the results here on this slide. We've had over 5,000 of our employees do the screening tool and sign up for appointments. We've got over 3,800 results, and as you can see, the prevalence is extremely low, certainly within our workforce, but we also offered it to other employers, and we had 659 of those tests so far completed with only one positive antibody. So I think that tells us a story that we do not have a breadth of asymptomatic or mildly symptomatic people who are infected here in Hawaii. And I have to tell you, every time somebody that I'm aware of was given their result, there was a bit of disappointment, because people had wished that they had had the antibody and therefore would have some form of immunity related to COVID-19. But I think that's a false sense of security. We don't know for sure, based on the science, that it does provide immunity, and if so, to what degree and for how long. And so I think this is a good news story as it relates to the efforts of the leadership, as well as the efforts of the people of Hawaii in terms of having good discipline at following what they were asked to do and really flattening the curve in a meaningful way. Next slide, please. Well, I guess I lied. This is one more about Hawaii Pacific Health. When we started to see the impact that this was having on our organization, we knew it was going to be significant. We gave up about 70% of our normal volume of activity when we closed down to elective procedures, and that certainly had a financial impact on us. But every resource that we had at that time was focused on flattening the curve and caring for the patients that we had within our facility and protecting our employee base during that process. But we also saw from a very early point that we had an opportunity as a result of this to progress our strategies in terms of creating a value-based healthcare system. Do many of the things that we had been working on for years and likely had planned on working on for years to come, in terms of the way that we rolled out virtual care throughout our system, around the way that we implemented a work from home strategy, the way we administered the organization from a more remote basis, and the way that we would come back into the organization when it was time to begin opening up elective procedures, the way we would shift care to the outpatient environment and things of the like. And so, you know what they say, we don't want to waste a good pandemic and miss an opportunity. And so, you know, we have said that within our organization, we don't allow the term new normal. We refer to it as Hawaii Pacific Health Beyond, or in the future we'll often refer to it as, but we don't allow the term new normal because we don't anticipate that the future looking or resembling anything like the old normal. And so what we think this provides us an opportunity to do is truly drive cost out of the system while providing the very best care to the people of Hawaii. And so we intend to come back in a different way. And so what does that look like in practical terms? Our expectation is that in the future, on average, our outpatient clinic visits, 50% of them will be done virtually. And just to give you a snapshot of what that looks like, last week alone, we had visits that equaled 87% of our pre-COVID-19 average weekly volume, and 58% of them continued to be done virtually. And that's through either video conferencing, telemedicine, using our electronic medical record, or even telephone consults. And so we anticipate that not only will we be able to expand our access to our population of patients, but we'll be able to do it using technology in a much more efficient manner. And so we think we're going to look very, very different as we move to the future. Next slide, please. So this is a little bit about the data now. So as of this was as of Wednesday, we had 653 confirmed cases. I think now we have 655 confirmed cases. We've got 27 active cases within the state of Hawaii, and we've gone over 45 days without more than 5 new cases. So that's a tremendous effort in terms of flattening the curve. Now, had we not taken the steps that we had taken as a state, had the community not complied with that activity, we would have had well over 100,000 COVID cases by this point in time, had we not done those things. And again, we highlight what some of those activities were. Next slide, please. So this graphically represents this. The top chart shows what the trajectory would have been when we compare ourselves to what was happening across the United States, as well as what was happening internationally, excluding China. And you see the actual results for both Oahu and the state well outperform what that trajectory was, as well as outperform almost any country across the globe as it relates to this. I think the only one that's close to us at this point is Singapore. And so we're doing extremely well. Now, before we go to the next slide, I've got to warn you, don't get caught up in just the shape of the curve. And what you need to hear me say is, as you digest the data on the next slide, is this is a good news story. This provides us an opportunity. So with that, let's go to the next slide. So we've got a data analytics team that has produced the previous slide, as well as other slides that we've shared, that we've partnered with the Hawaii Data Collaborative, we've partnered with UHERO, we've partnered with the School of Epidemiology, and we have pretty consistently throughout the pandemic been sharing that information for the use by the governor and the mayors as they make decisions about reopening the community. And so what this chart shows us is that when we open inter-island travel and lift the quarantine on June 16th, we are going to likely see a surge. And that's mostly because we're going to see increased activity, and we would expect that even some of those coming from the mainland or international destinations like they are now will move on to neighbor islands, and they will slip through the cracks, and we will see some spread. But the most important piece of this slide is the line going across the top that's showing that we have a big gap between any second surge that we would expect as a result of opening things up and the capacity within our health system. And so you see the similar outcome when you look at a potential opening on August 1st to travel domestically and internationally. And that extends a little while longer. But as long as everybody does their part, our government makes that decision and has a well-developed plan about how they're going to take on their responsibilities to execute that plan. And we as a community continue to do the things that we know that is expected of us. And I'll get into the details of both of those, what's expected of the government, what's expected of us as individuals a little bit later on. But if we do those things, we can fully expect to stay within the limits of the capacity of our existing healthcare system. Now, I will tell you, that is a good news story. That is exactly what we're trying to do. We're trying to mitigate the risk such that we can control it within the existing resources. Anybody who has a thought that we are going to live without the virus in the future somehow is misinformed. We are going to have COVID-19 in some form or fashion exist within our community, across the country, and across the globe for probably the rest of time. The question is, can we put risk mitigating factors in place that make it controllable? So there's a couple of things further about this slide. It does not assume that during this time we have a vaccine. So this is just based on things that we can do from a government planning standpoint and from a personal responsibility standpoint. It also assumes that we have on average 10,000 visitors per day throughout the course of the year, which is slightly higher than what UHERO is projecting at 7,000 to 8,000 travelers per day. And it also doesn't consider that we have multiple super spreaders, if you will. So that's somebody who gets on an airplane, they're highly infectious, and they walk up and down the hallway coughing on people. Those are super spreaders. So as long as we don't have those things, we believe that these projections are pretty accurate. And what that has us moving to is during the peak of the second surge, up to 40 to 50 new cases per day. But again, that is well within the limits of what we can handle within the existing resources and capabilities of the health systems here in Hawaii. And so to me, as long as everybody does their part, again, which I'll describe a little later, this is a good news story. And I'm sure there'll be questions about this once I get through my talk. Next slide, please. So I'm going to shift a little bit to the pandemic cycle. And this is just a little insight into how we've been viewing the world as it relates to the entire pandemic. The first phase was public health, which was really about stopping the spread of the disease, flattening the curve, and developing criteria for how we were going to evaluate the risk levels and how we were going to use those risk levels and our capabilities to really reopen the community. So if you go to the next slide, you'll see the tool that was developed. Several of us on this call or on this Zoom were part of the Public Health Recovery Task Force that developed this matrix. And what it really does is it breaks the different risk levels down and then evaluates them against essentially health determinants, which include disease activity made up of severity and prevalence and capacity of the health system, made up of what supplies, PPE, and things of the like, our ability to contact trace, and our ability to do diagnostic testing as necessary, and then has a prescribed response based on where we're at against that risk level and against those health determinants. And so this is a tool that was handed over to the governor, and it's the basis for what he's using as he thinks through the decisions he's making to move us from risk level to risk level. Next slide, please. So the remainder of the things, the humanitarian rapid relief, this is an area where at Hawaii Pacific Health, we haven't certainly been at the tip of the spear in terms of providing leadership, but I could say without question that the Hawaii Community Foundation under Micah's leadership and the board's leadership has. And you've made, I mean, I'm blown away to hear that you're approaching putting $10 million to work out in the community to help the people, whether it's with dealing with issues related to food security, related to financial stresses, and things of the like. That is true leadership of what is needed as it relates to this phase. And Hawaii Community Foundation stepped up right off the bat. So please accept my most sincere thank you for all the work that you've done in that regard. Next is reopening the economy within Hawaii. I can tell you without any question from a public health standpoint, or at least within my sphere of influence, that there's no reason that we shouldn't be where we're at today, and that we might have been able to get there even a little quicker, and why I'm more than comfortable with opening up the inter-island travel. The curve is flat, the disease is, there's much greater risk to us as we move about our community than catching COVID-19 right now because of the prevalence that currently exists. And so what I would say is that what we need to do to be able to sustain that within that, as we circulate throughout Hawaii as just our own communities, is we need to continue to social distance. We need to continue to wear masks. We need to make sure we're practicing good hand hygiene and overall general hygiene. And probably most importantly, if you're not feeling well, if you're symptomatic, if you're sick, if you feel not quite right, stay home and keep others safe and healthy while you bring yourself to the mend and take care of yourself. And so I feel very good if we all can remain disciplined about that we're spot on where we're at now. And the next is opening the travel and tourism. That's going to require a little bit more work. And I think we're probably not too long from hearing some information about when that might happen or how it might happen in phases or otherwise. But I think a couple of the most important pieces is we've got to have a state plan. We've got to have a plan that is clear. It instills confidence in the community. It has a full description of how we're going to screen people, how we're going to test people as necessary, what abilities we have to contact trace based on the volumes of people that will be flowing into the community, and we have to be able to quarantine if that's necessary. And notice I didn't say having a vaccine, because I think there is, based on the slide I showed you before, a safe way for us to open up the community as long as we have a statewide plan that is bought into by our counties, and it very clearly details what's expected of each sector. And then lastly, we've got to have community compliance. We need to commit to doing all the same things around good personal behaviors as we've seen that has allowed us to flatten the curve and operate safely within Hawaii among itself. And so this is as we see the pandemic cycle. Now I want to sort of wrap up here with a little bit of a story. So if we can go to the next slide, please. So this is a picture of the Choluteca Bridge in Honduras. And you might wonder why I'm talking about a bridge in Honduras, but you'll get it in a second. This bridge was built in 1935. It was part of an economic stimulus initiative that they had in Honduras, and they were building bridges, building infrastructure, and doing a number of things to stimulate the economy back then. So they brought in the U.S. Corps Army of Engineers to build the Choluteca Bridge. It was designed to withstand a Category 5 hurricane, and it did just that. It had a number of hurricanes during the course of the life of the bridge, and it withstood Hurricane Mitch in 1998, which brought over 75 inches of rain. It did exactly what it was intended to do, but there was one problem. Next slide. With Hurricane Mitch, the river moved, and so the bridge wasn't able to accomplish. While it stood strong, it withstood the hurricane, it was no longer solving the problem that it was intended to solve. And so if you go to the next slide, please. When we started this pandemic, we were experiencing the best of times. Markets were at an all-time high. Tourism here in Hawaii was over 10 million a year. We were We were at the highest occupancies we had ever experienced. Unemployment was an all-time high, but the river has moved, and the times are different, and it happened literally almost overnight. And so we've got to reshape, if us as leaders, if we're going to look at how we come out of this and what our future holds, we have to look at that as through a different lens. We have to expect more of ourselves as leaders and as the leaders that we elect in terms of how we go about addressing things. First, we got to have a plan. We've got to have a plan at the statewide basis that addresses all the things we've talked about in the past about how to come out of the risk environment from COVID-19. It has to filter down to the counties. It has to be defined by how it impacts each sectors. But we also got to rethink in terms of how we view the future based on what we know now, in terms of even how we plan for tourism as our major economic driver in the state, how we use the land that we have available, how we educate our kids throughout the state, how do we address affordable housing. And I think all of those must be looked at through a different lens. And frankly, I think it's incumbent on us leaders to help define what that future reality is, because just like in the case of Hurricane Mitch, the river has moved. And so with that, I will stop and be available for any questions.
Thank you, Ray. I'll let you take a sip of water. That was a lot, and really appreciated your thoughts. Very provocative. Joanne, if you could you go back to that forecasting slide that Ray spent quite a bit of time on? This slide, Ray, we've been trained as a community to be really sensitive to single-digit numbers of COVID cases day over day. When we get 2 day-over-day reads at 3 new cases, we've been kind of programmed to freak out a bit. This slide shows that, we're going to be managing 300 active cases, and I think you mathed that out as roughly 30 to 40 new active cases a day. How are we going to desensitize our community to that so that they see this as a manageable number?
Well, I think there needs to be an active communication plan about that. I think our leaders need to not be afraid to share this kind of information and articulate that we have the systems and structures and plans in place to be able to handle this kind of caseload. I can tell you, as one of those who will be at the forefront of it, as the CEO of a health system, we're certainly prepared and feel very comfortable with being able to do that. But the reality of it is COVID-19 is here to stay. And we can get very comfortable with having 0 or 2 or 5 cases a day, as long as we're willing to have no economic activity happening throughout the state. But that's not a reality for the long term. And so I would argue that with this kind of condition, with this kind of flow of the virus, it's not so different than what we've learned to live with as it relates to the flu, okay? This is what we do as a health system every year. We encourage people to get a vaccine. We encourage people to stay home when they're sick. We encourage people to wash their hands frequently. And through doing those things, we've created enough filters that keep the flu contained within the resources available within the existing health system. But if you think about it, that is exactly why we have seasonal activity now. We don't have seasons really here in Hawaii, yet I can tell you from a healthcare system standpoint, our seasonal activity is directly related to the spread of the flu during the seasonal periods in which the flu lives. And we've become very used to that. We're used to staffing up for that. We're used to expanding our capabilities and managing that. We as a community, and certainly we as a healthcare system, when I say healthcare system, I mean the broader healthcare system, have to get very comfortable with that as it relates to COVID-19, because it's here to stay.
One of the follow-up questions, Ray, was Is the governor and lieutenant governor and Dr. Anderson aware of this projection? And if so, what would their reaction be to this degree of active cases day over day?
Well, you all are the first to see this model, and so no, they have not seen this particular projection, and I have not seen projections like this that they have developed. That being said, I have heard the governor say on multiple occasions that that once we open things up, we are going to see a greater prevalence of the virus, and we just need to be prepared to handle it. So I think intellectually they're very well of what this says, but in terms of the modeling of what the actual numbers are, they certainly haven't seen this model, and I'm not sure what modeling they've done. But they're aware that of the general situation.
Yeah. You know, one of the questions that just came in is just trying to question was, what would be the long-term health consequences to a prolonged recession or depression? Seems like the community is not equally focused on the health costs. They're not getting our economy going again.
Yeah,
no. Thinking around that.
You know, you may have heard me opine during one of the select committee with the speakers that I thought we were at a tipping point where the other risk associated with COVID-19 and keeping the community closed for a prolonged period had become greater than the risk of the public health issue related to infections of the virus. And I believe that to be true. We're beginning to see that within our institutions, the people who have put care off come in probably in a lesser state of health than they would have had they acted earlier. We currently have a pretty active campaign going on, letting people know that it's safe to come into the hospitals. If they have a need for care, they should seek that care, because I think certainly from a physical standpoint, pushing necessary care off just causes more catastrophic type outcomes. But I also think, you know, the prolonged depression of the economy leads to certainly health issues like depression and the like, but it also will lead to just other challenges that will cause the economic challenges that this community faces to be much more prolonged, because there's a much longer tail to this that exists past the time in which we open up the community and open up the economy.
You know, you were an early adopter to taking swift action on trying to suppress the curve, flatten the curve, by the interventions that you had talked in your presentation. And now you're an early adopter on accelerating the reopening of our economy and bringing tourism back. You've said that publicly, and you've been pretty strong in that opinion. You know, is your thoughts that you can have minimal barriers to visitors coming in? You know, the terms that are being used are more freestyle or bareback for other places and visitors to come, or do you feel like there should be a high degree of testing and contact tracing and impositions placed on the visitors, you know, before getting here, in order for them to move around freely in our community? Where do you stand in that spectrum?
Well, to me, you use the term bareback. You know, bareback to me means just saying, yes, now we're open for business and we have no plan. I am not supportive of that. I am supportive of having a well-developed plan that uses the resources and technology that we have available to us, executed with some degree of precision. And those are all going to be based around screening, testing, contact tracing, and the ability to quarantine until a vaccine is available. Everybody would like to see people tested from a brand and safety standpoint before they come into the state. But I think, you know, there's been much discussion around that, and both from a jurisdiction standpoint around who would authorize and do that testing, what legal ability we have to mandate testing, and frankly, from my standpoint, the efficacy of the available rapid test. You know, right now we hear a lot about the Abbott Labs test, which I think probably has the most consistent, accurate reporting data, and while it's rapid, you can get a positive within 5 minutes, you can get a negative within 13 minutes. It's a linear test, which means you can only do one at a time. And so if you think about boarding one plane, let alone 10 planes, and trying to get people tested, the number of testing machines and personnel you would have to do that in a linear fashion makes it unachievable. And so I think what we have to do is take all of those things that we've discussed and layer them on top of one another, which allows us to mitigate the risk enough such that we create the results like indicated in this slide, where it provides enough protection and risk mitigation that we can keep the virus within the abilities of the existing systems.
You know, this next question did the math on this graph that we're looking at right now. It says with 4,600 cumulative cases through 2021 and a higher mortality rate for the elderly, we can expect the majority of the expected 120 deaths to be our cherished kupuna. Are there specific plans to keep our kupuna safe, or just what are your thoughts about that, and how could we, mitigate that issue?
Well, I think that gets into how we as a community, and specifically at the state and county level, how we plan that. There's nothing to say that as we begin opening up the community and that we don't have restrictions for the kupuna, that we don't have different expectations or guidance, at least advising them not to go out and not to expose themselves during certain periods of time. If you look at this chart, if we do open up on August 1st with either to both domestic and international, or even a travel bubble, as people have been talking about, I would say the stay-at-home order for kupuna as a guidance would make good sense for a period of time. But again, I think that's going to be true for the foreseeable future, that we need to take those most vulnerable populations and provide them guidance that is slightly worded stronger than the rest of the community.
This next viewer participant says, the public needs to see this chart. Future COVID-19 cases, says here, the public needs to see the chart projects future COVID-19 cases and what will happen. It will help to take the fear our future in reopening our economy and for opening up tourism. What does a plan need to come first before we can mainstream this conversation with a graph like this, or do you think we can go first with a more public conversation around this forecasting? Right? What you're thinking on that?
Ideally, what would happen is, look, the only one who can make a decision about lifting the quarantine, and that's really what we're talking about here, is lifting the quarantine. The only one who can make that decision, and he's made it clear, is the governor. And so as the governor communicates his plan let's just assume that it follows these timelines. And I don't know if it does or not, but if it does, he announces a plan to extend the emergency order through August 1st, and then or through the end of July. He announces a plan to lift the quarantine August 1st. He should share this kind of data that shows what the expectation for the impact of the virus on our community would be, and then he would follow on with that, all as part of one communication, what his plan is in conjunction with this model that would say what we're going to do, how we're going to mitigate the risk that would produce this kind of outcomes that keeps us within the limits of the existing healthcare system. And so I think if you hand all this out in piecemeal, it's too hard to follow. And people will, if you just put this out there without a plan, it'll scare people to death. If you notice, when I shared this with the group, before I ever moved to this slide, I made some introductory comments. I had to say very clearly that this is a good news story. This says we can work within the existing healthcare systems, even if we open things up, if we do the right things. And so, but if you don't communicate all that together, most people will just see the shaded area. They will see potentially 2 or 3 surges, depending on how you look at this, equal to the first, and it'll scare them to death. And so if this isn't done, that shows both the opportunity we have to provide stimulus to the economy, with what the real risk is and what our plan is to mitigate that risk. I think we're in trouble.
You know, Ray, I want to try to share with the audience some conversation that you and I have had offline. I know we didn't talk about really having this conversation on this panel, but Joanne, if you can go back to the rainbow colored health index that Ray, right there. Yeah. Ray, you and I talked about trying to develop a tool that allows government to kind of forecast and manage a future based on some primary indices. This is the healthcare index that we're attempting to get counties to adopt, and it looks like the mayors have accepted this as a means to understand, you know, the health index. And you and I both have talked about, you know, the COVID mandates, or what some would call, you know, the impairment on some of our civil liberties, and we've identified 10 or so of those mandates. And then the economic driver, and you and I talked about managing the reduction of an unemployment number. And you, myself, along with Hawaii Data Collaborative, with Mike Moore's participation, he's driving on a lot of this data. How can those 3 indices help forecast? And so, you know, if those are indices that can be quantifiable to help us be able to provide a tool to forecast out, you know, when we have to ratchet back. And I think really for the audience to kind of see where it can be a communication tool so that people can have a higher confidence level when COVID numbers hit 10, 20, 30, 40, or 50, or perhaps 80. You know, what are the actions that government is going to take that can give us a sense of comfort that we can manage that number and we can remain open as an economy, or just ratchet up maybe one more mandate and we'll be okay. What's your thinking around that?
Yeah, you know, I think that, you know, first of all, I think you're right. I think using these tools as a gauge for measuring the activity and the impact that it's having in our community, so that we can use the toggles at our disposal, if you will, and the toggles would be the civil liberties, as you call them, to manage the prevalence of the virus. Now, I've been pretty outspoken about the fact that I think, you know, what we did as a community in terms of locking things down the way that we did, I mean, imposing the quarantine, stay-at-home orders, things of the like, I think we got one shot at that. I think that happened once. And so what that says is the leadership needs to be very deliberate about how to use those tools that you described, this matrix, the unemployment data, the civil liberties that we have access to, and be very deliberate about how we reopen things, how we enforce the expectations that are laid out in the plan. So if there's certain capacities in restaurants or social distancing requirements, how do we enforce those things, and then be very deliberate about when we have to pull back. It cannot be done emotionally, because I will tell you that if we don't, I mean, the best case scenario would be that we use these tools to open up deliberately and enforce compliance such that we never have to pull back. Now, the governor has said multiple times that if we see a spike in the virus, we may have to pull back. The mayors have all said that as well. But I will tell you, if we have to do that, we will have less compliance than we've had in the past, and it'll be much more difficult to get control of the virus. So we are much better served by having a very well thought out plan that is executed with precision and enforced precisely.
You know, this question might be answered by the antibody slide that you did, and you don't have to go there, Joanne, but this viewer says, with the trickle of new cases that's happening right now, what's the likelihood that there are a material number of active cases in our community today?
I think slim to none. I think You know, I make my way around to my various hospitals and check in, and I go, so I spend a fair amount of time on the roads, and I can tell you, I feel like my health is at much greater risk while I'm in my car driving to those locations than it is from contracting coronavirus.
Yeah, this one goes back to the, the projecting curve.
But I should add to that, Micah, I should add that only because I'm always wearing a mask, I practice good hand hygiene, and I socially distant. If I didn't do those, then it would be different. But as long as everybody's doing that, I think we're pretty safe doing what we're doing.
Yeah. This one goes back to the curve, projected curve slide again. What assumptions are being made that result in this curve flattening? I think you touched on a little bit of that, but could you be a little bit more elaborate a little bit more on that?
That's a good question, and it's not intuitive. But what ends up happening is you get the influx of during a period of time when you start to get up to 10,000 visitors a day. You see the virus being imported into Hawaii, and so that causes the surge. But what we change as a result of the plan and the social distancing, or as the personal responsibilities, is the P rate, which basically means it's the rate in which each one of us who are infected spread the virus. And so by doing all the things that we do, and through the plan being executed by our leaders and each individually doing our things, we change the rate of spread from, I'm infected, I infect 4 people. If we do all the right things, that number changes to 2 instead of 4. And so that's what causes it to arithmetically to go down as a result of that.
Right. If you could go now.
When the model was presented to me, and I reviewed the data to make sure that I clearly understood it. But it all comes down to, because we're doing all the right things, those who are infected will spread to less people. That's why I get the caveat in there, unless we have super spreaders.
Yeah, a couple more quick questions. John, if you can go back to the projected curve slide again. This might be hard to answer, Ray, but this viewer would like you to project, what would it look like what would a bareback curve look like, and what would be a heavily restrictedly mandate, like what we would call a level 5 mandate on civil liberties. So what would be the difference in those two curves? I'm sure the mandates would be flat, right? But
yeah,
what
mandates would be flat. I don't think there's any reason to believe that it would change now if we if we kept a stay-at-home order and we kept the quarantine in place. And the first question is if we went I think what this curve would look like if we didn't put precautions in place. If you go back one slide to the other chart, it would look an awful lot like different time horizon, obviously, but it would look an awful lot like what we saw in the first wave with the U.S. and internationally. That essentially is the curve without, now it might look a little different within the model, but it would roughly be similar, that it would be an uncontrolled acceleration of case spread if we didn't do any of the things that we were supposed to do from a leadership planning standpoint or from a personal responsibility standpoint. And
then this last question, one of the viewers in the previous question set the 120 as the mortality rate. Is that an accurate number in your projections under that current curve through 2021? Back? Yeah, so one slide forward, Joanne. So this curve. I'm not sure if that number's in there or if it was just yeah, I
don't know where that number come from, but the mortality rate has been extremely low in Hawaii. I think I got it here. Hold on one second. The mortality rate, give me 1 second here. I think the mortality rate has been less than like 2% here in Hawaii, and so I don't have it sitting here in front of me, but it's been extremely low. So I think it would continue to be low in this case.
Yeah, I think this person was saying roughly 2.5% was their calculation. That's what they
Yeah,
used.
2.5% I think is the national number, and but we've been below that here in Hawaii.
Yeah. And just while we're still on it, what would be the behavioral assumptions that you're speaking to as it relates to this current curve?
You mean for the individuals?
Yeah, yeah.
Individuals, it's the same. Is that we social distance, we continue to wear masks. Certainly during the, I think we will reach a point where this will be more of a seasonal activity. So certainly during the seasonal activity, we wear masks. We always are promoters of hand hygiene, and it'll be even more important that we stay home when we're not feeling well.
Well, Ray, I think on behalf of our viewers, on our donors, and quite frankly, the people of Hawaii, can't thank you enough for making yourself available, for doing what you're doing out in our community to lead in this space. I mean, we love what you're doing in your organization with Beyond the Walls, and really talking about, solving these problems upstream. In the nonprofit community, one of our challenges is that we tend to be meeting them, at the end of the pipeline. And like you, we think we got to get upstream and get some of this systemic change happening so that, many more can thrive and we can manage some of our issues better. So thank you very much for all that you do, and, look forward to being with you going forward. I'd also like to thank all of our donors who are with us today and before and tomorrow. What you folks are doing is giving us a shot to make a difference out there in our community. So thank you for being with us. I want to inform everyone that on June 29th at 1 p.m., we're going to have our next virtual briefing. It's going to be with Dr. David Lasner, President of the University of Hawaii. Also helping me to facilitate that conversation is going to be Terry George, who is the President and CEO of the Castle Foundation. Dr. Lasner has been thinking real hard about what the future of the university is going to look like within the post-COVID period. He already has launched a couple programs that I spoke about earlier in my introduction. We think that is one of those type of systemic changes that's going to need to happen in terms of how we elevate the floor of our community, of those kids that don't have access to post-secondary opportunities. I can tell you that initiative would never have been launched in a peacetime period, and I don't think Bob and others would have been able to really drive that opportunity forward. But that's a real good opportunity. You'll hear more about that on June 29th. And so if you want more updates about what we're doing in the meantime, I want to really push people to our website at the hawaiicommunityfoundation.org. We update that weekly on the grants we're making and any new information we have. So on behalf of our team, our board at the Hawaii Community Foundation, I want to thank everybody for all you're doing, your interest, your participation, and your generous support of our community. Please stay well and have a great weekend. And again, Ray, mahalo for all you do, buddy. Mahalo, everyone.